We're looking at life expectancy by race ethnicity at the US county level. Public health is local, so it's very important for us to know what's happening at the county level. County is where the local health department is in charge of health. Unless you show disparities and what's happening at the US counties, you're not able to improve health. And let me give you some examples why it's very important. First, if you come right now in a state like Washington, where we live, and you say that's the life expectancy of the state, that's an average. So there's counties who have less, counties who are more. Unless you identify these counties and tell the public in these counties that's where your life expectancy is, you're not going to help the officials in that county to ask for resources. You're not going to empower the people in that community to ask why. Why are we so behind?
Really big disparities in life expectancy among different racial and ethnic groups in the US, and also really big differences among different counties in the US. And in general, over the entire period that we were looking at, there were, for most groups, increases in life expectancy from 2000 to 2019, but most of those increases occurred almost exclusively from 2000 to 2010. And then after 2010, what you see is for a lot of groups, life expectancy really just stagnated, and then actually for some groups it declined. And so there's already this really concerning kind of thing happening in the 2010s, and that's before we know what's coming up next with COVID, which really just makes everything much worse.
In any nation, life expectancy as a summary measure is a reflection of the social, environmental, economic conditions, as much as it is a reflection of the quality, the quantity, and adequacy of the healthcare, both clinical and public health infrastructure and system. So it's really important that we take account of it and study it properly.
The novelty of looking at it through a race ethnicity lens, adjusted for gender, age, socioeconomic status, and geographic location, in this case county, allows us to give us a much more detailed picture of where differences exist and are important.
Minorities will delay medical care simply because they can't afford it. People who have health insurance here, people who are affluent, do what we call preventive medical care. They go for screening. They catch a disease early on. That's not true for many minorities in the United States. Racism plays a big factor in it.
The big reason that we think we see disparities, particularly for the Black population, for the Indigenous population, is systemic racism. So our study doesn't get into why these disparities exist, but if you look at a lot of other research, there's tons of research that supports that various forms of racism really have a very negative outcome or very negative impact on Black and Indigenous populations. And that may change over time in various ways, but it's sort of easy to look outside and say, racism has not gone anywhere. And so it's not that surprising in that context that these disparities haven't gone anywhere. If we compare 2019 to 2000, most racial and ethnic groups saw an increase in life expectancy over that period. However, the size of that increase varied a lot, so it's biggest by a pretty substantial margin for the Black population in the US, and then it's smallest among groups that saw an increase for the white population in the US. And so that means that there's actually a bit of a narrowing of the gap between the Black and white populations, which on the face of it is a good thing. What's really shocking is that if you look at 2000 and 2019 for the American Indian Alaska Native population, life expectancy is effectively the same in those 2 years. So there was basically no improvement in life expectancy for that group over a 20-year period, which is really, really unusual and really alarming.
And this may be one of the first publications that shows that Asian Americans have a longer life expectancy than even Latinos. And that always presents questions as to why. Why are things worse for some groups, or why are things better for other groups? And if we can get at the detail of geographic location, I think that even gives us more information as to what could be done about it, or what could we learn from places that do well to sustain it and transfer it to other places.
There is no magic solution here. We need to invest in our community. These disparities are caused by four major reasons: socioeconomic factors, for example, education and income; access to medical care, people who have health insurance or don't; quality of medical care, and we don't mean medical errors here, we mean delay of care. So when you reach the medical system, it's too late and the outcome is not as good. And the last one is preventable risk factors: smoking, diabetes, blood pressure. We need to address these four together. So we need to have a program in the United States at the county level. Public health is local, where we address socioeconomic status, where we address the environment where people live. How could you expect somebody to be healthier if they don't have access to a place where they can be physically active, where they don't have access to fresh fruits and vegetables at a reasonable price, where they don't have access to a medical care and quality medical care? It's very important for all of us to invest in this community. It's time to have innovative approaches to solve these problems. It's time to stop investing in what's not working and invest what will work and improve health quality all over the United States.
Life expectancy is really this summary measure of kind of the overall health status of a particular place. So it's not a super specific way of saying what needs to be done. It's a better indicator that something needs to be done than anything else. But again, because we think that the big differences that we see in life expectancy are largely the result of these big structural factors, right? Systemic racism, big socioeconomic inequalities, et cetera. Really meaningfully dealing with them on a broad scale probably means dealing with systemic racism, socioeconomic inequality, et cetera, on a broad scale. We do have additional work that we're doing past the study of life expectancy that looks at causes of death. And so then we can see how, different levels of mortality from specific causes contribute to these differences in life expectancy. And that may also suggest some more specific types of interventions that are needed for different populations. But really we think that it's these broad things that need to change in order to change life expectancy. In the US, most public health activities, so public health departments and so on, are actually organized around counties. So that's either that the public health departments themselves are at the county level or they're at the state level, but it's kind of the activities are divided up at the county level. So it's an appropriate level of analysis from that perspective as well. And our greatest ambition with this is that it's useful to local officials and local actors who are trying to make health better in their communities.
This study is important. It should be an alarm bell for all of us to begin to address the root causes so we can truly eliminate health disparities and prolong life and longevity for everyone.